Hello and welcome to Doc SF. We are experiencing the orthopedic recovery. And in particular, we're exploring a lot of different features of what is required to get us back into our practice and taking care of delivering orthopedic care. And so we started out early this morning taking a look at the virus and taking a look at the workforce, the impacts. And now we're going into from the standpoint of we're using a lot more telemedicine, telehealth, digital tools. And to discuss what that looks like, I am so glad to have Ann Mont-Johnson. She is the current CEO of ATA, formerly known as the American Telemedicine Association. She's an entrepreneur. She's a rebel. She's also, we will say right now, a futures forecaster. I think you're going to have a lot to say about that, Ann. And then Joe Kvedar. Joe, you are, first of all, what people may not recognize is because they know you as an author and an evangelist for using telehealth and telemedicine, but you actually are also a professor at Harvard in dermatology, right?
Correct.
All right, so thank you again for joining us today. Let's just dive right into it from the standpoint of, since the pandemic, there has been an awful lot of change. And particularly what we've seen is the use and the exploration and the acceleration of using telemedicine. And why don't you start us off? Give us a sense of, you're sitting in this really interesting position because you're seeing practitioners, all the different disciplines, all across the country, urban centers, rural centers, and all of a sudden, whether you like it or not, because of the stay-at-home orders, the reduction in surgeries, the cancellation of all elective, we've had to do things a lot differently. What have you been hearing?
So I think from the practitioner or the clinician's perspective, what we've heard is a huge uptake. So when I first joined the ATA, I think adoption engagement by clinicians was pretty low, maybe in the 10% range. And more recently in research that the AMA did, pre-COVID, they looked at adoption at about 28%, which was already a big improvement over prior years. But now what we're seeing, anywhere from 60 to 90% adoption and use of telemedicine. And of course, that varies by specialty, but I think that the adoption rate has been pretty significant. What that's going to look like post-pandemic, I think remains to be seen. It's probably not going to be as low as 28%, but it's probably not going to be as high as 90% either.
Yeah, can you give us a sense of pre-pandemic, what was we'll say that usage rate? Would you want to say usage as opposed to adoption? Because adoption says that you're in that phase of bringing it on board. So what was the baseline use?
So again, I think it was more in the 14% range, up to 28% just pre-pandemic. And of course, that varies by specialty. Joe, you probably have some observations on that too, right?
Yeah, well, specifically orthopedic care. What was the usage rate there?
So I don't know specifics on orthopedics. I know the more procedural specialties have traditionally done less. It makes sense because their core business is done in the office. But I think many of them have learned during this crazy time that pre-ops can be done virtually, post-ops can be done virtually, physical therapy can be done virtually. So there's a lot of ways to do it. And what we end up seeing is people rethinking how they use their brick and mortar in the office and what's more efficient to get done virtually and what's better to make sure that the people coming in the office they really need to, et cetera. So that's kind of what's happening now, I think.
Yeah, so Ann, from the standpoint of, and Joe, I should say, you are president-elect. So it's good to have the two of you here because you're overseeing and hearing what's happening right now. And Joe, you better be ready because it sounds like it's getting a lot busier. Right? Is that true?
Oh yeah, sure. I've got my gloves on.
Yeah, good to know. So Ann, let's talk about how quickly this ramp up has been, and also what were the things that people were learning? What very specifically did they see? And let's keep this, again, to orthopedic care. What were some of the places, the very first, because everybody right now in orthopedic care not everyone, I should say, the vast majority of orthopedic care, they have had to delay, and they really haven't been having a full cycle of what care looks like, unless it was trauma or some things that were needed to be addressed during COVID. But during this period of time, which problems or which part of the care journey have they seen using telemedicine, telehealth? What aspects is best have they found the best results with?
So I'll just say what I've heard, because I'm not a clinician and rely on Joe for part of this. But my impression is that, as Joe indicated, the post-operative checks have been pretty effective using virtual services. So just as we're doing now, we're talking to each other using a video element, video audio element, or synchronous communication, and that's been pretty effective. I will say that I've had personal experience with physical therapy. I fractured my shoulder pre-COVID and did all of my rehab with physical therapy virtually. And I would get a text every morning telling me what exercises to do. So that sort of management, ongoing management of services, I think has been effective. And there's been a huge uptake in that. How clinicians or orthopedists have been able to engage with patients, I suspect, has been the same with others who've been very procedurally based in terms of helping them manage their pain, helping them manage their condition as they wait to be able to have a procedure. And again, Joe, you're the clinician in the crowd.
You're the clinician. What are you hearing?
We've pretty much covered it on the procedural side, but proceduralists do a lot of other things. They usually are quick to tell you that they're doctors. They're not just proceduralists, that they take care of patients. And orthopedics, of course, is not just operations. There's a lot of other things that go on. And anything that doesn't require you to touch the patient to make a decision, whether it be a diagnostic or therapeutic decision, it can be done by telehealth. And people are learning that every day, real time as we speak.
Yeah, so that virtual, being able to check in virtually. So one of the things that has been very specific to orthopedic care was the high rate of cancellations, or rescheduling. So so clearly they had been cleared for their procedure. There was a condition going on. So we're talking a little bit more about the post-op, and yes, you can do rehab. What are we doing in the interim from the standpoint of managing a situation there was a surgical need? How are we using the digital tools, the virtual environment, to address taking care of people while they are waiting?
Joe?
Well, yeah. Again, not being an orthopedic surgeon, I can only speculate, but if it involves a conversation about pain control, if it involves a conversation about range of motion, if it involves something that's mitigating while we wait for the OR time to come about, and of course a lot of these are elective joint procedures that, even though the person might be experiencing symptoms, can in fact wait. So it's really, I think, about coaching them through how to better manage their pain meds, how to better manage their range of motion, et cetera, their exercise level while we wait for those operating rooms to clear.
So it's really just being in touch with them. And I think one of the things that we've heard in prior sessions was the importance of building trust, that for many patients now rethinking about their surgical schedule, they are looking at this saying, what's my risk of picking up contracting the virus? So
sorry, go ahead. I would just say that the importance of building trust is predicated on having contact with your patients. And one of the things that I've heard pretty consistently from physician practices, not just orthopedists, but how pleasantly surprised patients have been with the outreach of the physician office.
Yep.
And they were under the assumption that because their procedure was canceled, that everything was shut down and they would not have any contact. So that simple act of picking up the phone and checking in has been incredibly powerful and very, very impactful.
So the value then of the video visit in that interim has been incredibly important as far as not only maintaining their level of physical well-being, but I think it's done a lot for the psychological well-being. And we know definitely that you recover better when you are in a better state of mind. And certainly the anxiety on every level has gone way up. So the video visit, that contact, does a lot to alleviate the psychological stress and manage anxiety and help them to be better prepared for their surgery. So one of the things that, we talked about having low adoption rates. One of those reasons for the low adoption rates is we had a lot of rules and regulations around how you could conduct a video visit, what the financial model looked like, who was qualified for that, what plans were covering. This there was this rapid change in, is it relaxation of the regulations? Was it a lack of enforcement? And you've been over there from the standpoint of thinking about government affairs and what those policies look like. So can you give us an understanding of what transpired that allowed us to move so rapidly into adopting virtual care?
Well, there was a series of waivers that were issued, and that was really important in terms of attacking, if you will, what were barriers to getting people care where and when they needed it. And so the traditional barriers in telehealth for widespread adoption have been licensure, it's been reimbursement, it's been connectivity, particularly broadband. And basically, two of those issues were, over the course of the past several weeks, have been mitigated. And so that has really created a huge surge. I think, it's safe to say that the 60 to 90% engagement or usage rate by physicians is driven in part because there's been a sense that they're going to get reimbursed. There's also some things, though, that we're concerned about. So, for example, the fact that there was enforcement discretion associated with HIPAA and the exchanges between clinicians and patients. We've been very concerned as an association and have taken a stand that said, just because you've adopted things quickly doesn't mean you should cut corners in quality. And so we're very concerned about that. We know our members are being very vigilant. Our members are very diverse. They include delivery systems, medical groups, academic medical centers, as well as solution providers and payers. And so it's been really terrific to see the response of these folks and recognizing that they do have to pay attention, even to privacy.
Well, I was just going to say there's a lot of layers of privacy. There's the data privacy. There is, during the interaction, the encounter, how do you make sure that that connection is secure? One of the other things that's come up that I hear across the board is that some of the challenges with the adoption is over on the patient side. Do they have access to the internet? Do they have the right type of tools? So as an association, Jill, let me ask you to comment on that. On that experience side, the very practical, what have we seen that was working, and what were the things that got in the way of it being a successful encounter on both ends of using telehealth?
Well, what's working is and it is extraordinary. I was worried when we started this journey in mid-March that we're going to have a lot of hiccups. I mean, we brought several 1,000% increases in all the delivery systems. The one where I work, we did 1,600 virtual encounters in February, and now we're doing 60,000 a week.
Wow. Okay, that is a huge. The magnitude, the
typical
scale,
all over the country, and yet all I really hear is positivity from both patients and clinicians. So I think kudos to all of our IT support and just people's willingness to say, we're going to try something new, and we're in a pandemic. So I would say that I would say as we come out of it and think about how we integrate telehealth into our physical practice, because the physical practice was never meant to go away. There's always going to be need for some patients to come into the office for certain things. We're talking about like having separate half days for telehealth. We're talking about have providers to conduct telehealth half days from their home so that we can use the brick and mortar differently. So that's a lot of what's going on now, is how we think about those And honestly, other companies and other industries have done this a decade ago, where you see companies like Uber and what have you, where they've thought about how to integrate a digital experience with a face-to-face experience. We need to go through that now in healthcare. As I was saying before we came on, it used to be viewed as a curiosity by most doctors. Now they've experienced it, their patients want it more. And so we've got to sort of come and say, all right, how do we clarify now what's best in office? How do we clarify how to integrate telehealth into these practices, et cetera? So it's a very exciting time for that.
Yeah, and you had mentioned that, that we had this huge rush. And sorry,
right.
you were going to
comment. Well, I was just going to say, I think the other thing that's worked has been sort of the broad range of services that can be used. So audio only, for example, the fact that people could just use their phone makes it incredibly easy for some cohorts, some populations who perhaps had not been versant with Zoom or whatever the technology may be that incorporated video and audio. So the phone only, I think, has been very beneficial in getting people to interact with their physicians. So I think, you know, what I find interesting in this is that what really has changed with telehealth is that it was viewed as sort of a convenience factor, and it was used primarily by young millennials, you know, younger folks who may not have a primary care physician, and it was just a matter of convenience. And now I think it's much more a matter of life and death for most people. And I think that the other thing that's really worked well is the whole emergence of asynchronous methods of communicating. And the fact that you have companies that provided services free most of the time, in fact, all the time, I think, that enabled a consumer to go and look and answer very specific questions to determine whether or not they were likely to have the virus, and how do they self-care. And what these asynchronous tools enabled was a huge ability to scale and to be efficient in a way delivery systems would not have been able to do otherwise. We have companies who are members who've done 75,000 asynchronous visits a day.
Just so, I mean, from the standpoint, are you referring to the chatbots where we're using symptom checkers?
You're using that, but you're also using interactive assessments or questionnaires. It's a guided conversation. So it's not nearly as cold or fruitless as just a chatbot. And I think it's been really remarkable how those have been really used extensively by consumers and by clinicians.
Well, I was just going to say, one of the things that I found really interesting on how we're managing prevention of transmission. We want to cut down transmission, and transmission has been a lot within essential workers, many of whom are clinicians. So actually the telehealth piece and the symptom checkers, the asynchronous, is let's check everybody before they come into work, before they come into surgery, before and after. So in the childcare centers, so many of the hospitals have put on-site childcare centers or areas, but they are addressing the needs of the childcare needs. So whether it's that clinician, and we're seeing that more in practices where they're using the asynchronous to determine if somebody is, appropriate for coming into work or appropriate for coming in for an in-person visit. So they're using that chatbot before they even, it's a hybrid. It's not an either or. It's just integrated into the entire care journey.
Experience. Yeah.
Right.
Yeah.
Right.
So,
and I think the reason why that's important is when at the ATA, what Joe and I talk about is that, pre-pandemic, we had a shortage of clinicians. We did not have enough clinicians to take care of our aging population with multi-chronic conditions. And this is a problem we're facing worldwide. And so if we use technology to just replace a face-to-face visit, we will have sold the whole thing short. And what we're seeing now is the ability for technology and telehealth to help reimagine care and how care is delivered. And so I think if you approach it from that vantage point, you find it more as a way of augmenting and supporting your practice, your interaction with patients, as opposed to a threat.
Yeah. So from the standpoint of thinking very specifically, we were talking about some of the regulations. And I remember several of the press conferences where Seema Verma was there. And she very specifically said, whether it's your phone, FaceTime, Zoom, conference call, she really opened that up. And we had to at that moment. What are your concerns? You know, we had this flood of usage and people were experimenting it. The first thing we need to do is be safe on many levels. And I don't think we're going to, we're going to see some, pullback on that. As we get better at this, what do we need to be concerned about to be safe so that the regulations that are going to be coming in place, how do we want to have regulations that allow us to be flexible and to explore new things and do it in a safe way? Have you got some thoughts about what we need to be thinking about and the language that we use as members of the orthopedic community to have the right things in place?
Well, I'll take a shot and show, because we've worked very closely on this, which is the statement that I mentioned that the ATA came out with that said, even if you're moving fast, don't cut corners. So the so-called genie out of the bottle, yes, it means that there's a lot of different ways that people are operating, but clearly some are not appropriate. So FaceTime, for example, or Facebook Live, or TikTok. I don't even know how you use TikTok, but still.
I've seen some pretty effective orthopedic surgeons doing that with kids, getting them to dance, as part of their therapy. Yeah. And I think that let's take a look at TikTok just for a second.
Okay.
Where I've seen the orthopedic community, well, actually the community that's taking care of the millennials and younger, that's who's on there. And so from the standpoint of getting them to be more active, to understand better health behaviors, that's where that segment of our population, that's where they spend their time. So I think figuring out how to use that. But yeah, I've seen several of the orthopedic surgeons with their recovery for young kids, they get them up dancing. And it's been, well received.
They're meeting their customers where they are, which is really important. And I think that's the big change that happened here, is that we're meeting people where they are.
Right. And it feels like the vast majority of the change has been over on the provider side, actually. We've actually, customers, clients, patients, depending upon where you are on the care continuum, they have been using digital services for a lot of their life. And I think many of them have been interested and eager for their healthcare to transition over there as well. And so, Joe, my experience as a clinician is my patients have been ready for this. Some of my colleagues have not. What have you seen?
Yeah, in about 27 years of working in the space, I probably could count on one hand the number of patients who had some challenge. And other than I can't get the technology to work right, that's still something we need to get better at, is making it so dead simple for all parties to connect. But other than that, once the experience is had, that when you get this magical, I think it's magical, coalescence of access, quality, and convenience, everyone's happy, everyone wins. And I think that's really the way we have to view these interactions, is when we can see those three things coming together at once, and we know we've done a good job. You have to have quality. Ann just mentioned that, and I would underscore that 10 times. We're not talking about cutting corners. But there is something to be said about being patient-centric, about the fact that patients can get care where they are when they need it. Interestingly, one just quick example is during this time, and my colleagues that I've talked to all say the same thing, the no-show rate for appointments has gone way down because you're catching people when the appointment is in their own home. It's simple thing, but that used to drive people nuts, as you know, the no-show rate, and it's almost zero with virtual.
That's, I was gonna say, the other thing too, that I was in another conference and we were talking about the number of cancellations was super high, and then trying to get the reschedule. So it was interesting that when one of the clinical staff, one of the nurses or the surgeons reached out to reschedule a procedure, that reschedule rate was up like around 80%. Whereas
Sure.
if it had just been, let me send you an email, but when they actually used some type of an interaction, they were, those cancellations they were rescheduled.
Yep.
So we've got several questions. One of them is talking about telehealth as a platform on which we can hang the other tools through which we can optimize the use of our electronic health records. So have you got anything to say about that, Joe?
Well, integration with electronic records is one of the important things. I think that question gets at workflow, and one of the things we used to cite as a barrier prior to the pandemic was workflow, that you couldn't, excuse me, expect clinicians to be on a platform like this and then have to change screens to look at the electronic record. This morning I did virtual visits. I launched, I think, about 6 or 7 of them right from Epic. We have integrated Zoom into Epic where I work, and it's a beautiful thing. Patients come into a waiting room from the patient portal. It feels very much like an experience that mimics being in the office. So that integration is important. And the other tools are things like devices, remote monitoring devices.
Yeah.
That can give you more information. Things like that we will continue to see proliferate because they're important for home testing is another one, lab tests that we can do at home. More and more of those will come out, and that will give us more and more opportunity to make these virtual visits more plentiful and more meaningful.
Right, and have it be an integrated experience. So one of the things that's really going to change, and we need to think about this for our orthopedic patients, is recovery. So if you've got somebody who has a comorbidity and they're elderly and they were in isolation, they're not going to be able to go directly to a skilled nursing facility or a rehab center. We're going to have to rely on remote monitoring and doing virtual visits. So thinking about that entire experience, how are we integrating wearables, remote monitoring and sensors within Zoom, as well as the EMR and dashboards, so that we know all these people that we are managing at home, how do we know who needs to be seen at what moment for what problem, or, just to check in on them, so that it's not just, okay, Monday, here are all the people that we follow up with, that it's really driven by the clinical data. Are we seeing that? Is that something to get excited about?
Well, I think it is. And I would say that the integration point is the electronic record. That's where these all come together. That I don't think, I can't say Zoom, I don't know their technology roadmap, but I doubt that it involves connecting a lot of peripheral devices. Whereas we're getting both of those integrations right now through Epic where I work. And so that indeed I can be on a video call with you, and then half the screen could show your home blood pressure readings, all in the same experience.
So we have another question. Go ahead, Ann.
Sorry, I would just add to that the whole notion of remote monitoring, the idea of using data to flag a situation before it gets really bad has something that we've seen incredible advances in terms of remote monitoring. And, being able to tag a patient for a possible problem before it even surfaces has been a real advent of the use of AI and machine learning and integrating that in digital devices. So there's no reason why it's not going to continue to explode.
Well, that's one of the things that you had mentioned. I've heard you speak about this, Anne, that too often times when we think about telehealth or telemedicine, we're thinking about this synchronous face-to-face interaction like what we're having right here. But it is a much more expanded experience, and it is an ability for us to actually better understand a health problem and an illness journey. And so from that data, when we're able to actually mine that and using AI and machine learning, it actually tells us, this is the person who's at risk. And so it actually improves our care, our learning around all of that. I think you've mentioned quite a bit about how, that we think about it as the interaction, but you're really thinking about it on the back end as how we're collecting data to actually deliver better care. Have you got some examples that you've seen that you wanted to encourage us to pursue more aggressively?
Well, I just think the whole idea of people aging in place or aging home is one that really lends itself to that sort of passive monitoring. I always love the expression or the description of the beauty of an Amazon Kindle is that you order it online, it shows up at your house, you turn it on, and it works. And the bottom line of that is if you want someone to do something, don't make them do it. And so that is really the power of remote monitoring. And that's why it's so interesting to see companies like Best Buy get into healthcare in a big way, starting with their acquisition of Great Call in December 2018. So you think about, your parents, your elderly parents at home, and one of them has procedure, and you want to make sure that they're okay. You're going to have Geek Squad go out to their house and outfit it for remote monitoring, and very passive, but they're going to be watched in a way that they weren't before. That's
okay. That it is dramatic. It is shifting. I mean, Joe, you had mentioned that what you were talking about in evangelizing 2 months ago, some of the presentations that you've looked at, they're dinosaurs at this point. They're not relevant.
Yeah. It seems so very quaint to go back and look at slides that I presented at the end of January. It's really amazing.
Yeah.
And what we're really focused on now is that future experience where, and I keep mentioning companies like Uber, maybe that's too abstract for people, but there are so many examples in your non-health care world where you have an integrated in-person digital experience and you don't think too much about it. And that's where we have to head. We have to we have to present ourselves to our patients as digital organizations. We have to have them properly cared for. We look forward to the day when someone shows up at the offices. Why did I need to be here for this? Right? And as opposed to everyone who shows up saying, well, by golly, I better come for that appointment because I've been chosen to come in. That means something really special has to happen here that's in, as opposed to, let's talk for 5 minutes about your last lab test and send you on your way.
So one of the other questions, orthopedic surgeons are heavily reliant on radiographs, MRI, and imaging, and less on the physical exam. So are there any technologies that are going to have, that are for us to access the imaging at the time of the telemedicine visit? Are these technologies, are they going to allow our patients imaging modalities in a compliant way during COVID?
So I'll take a crack at that. That's a very futuristic and it's a great question. And I don't know of any home X-ray devices that are on the horizon. I do know that 10 years ago we were talking about portable ultrasound, and that's now a thing. So these things that sound a little bit Jetson-esque, give it 10 years and you'll start to see it. In the meantime, the answer to that question in the current state is the integration of this into the electronic record. So the patient has to go to an imaging center to get an image done, but then when you have your conversation with them virtually, you can access that and go over it with them. And our patients increasingly can access at least the reports in our patient portal, if not the actual image.
And then another piece that's going to be so vital to care is home testing. If we've got somebody that's scheduled for surgery, we need to figure out if they are actively carrying virus. Are they somebody who is? Are we going to be actually able to deliver the surgery? If so, what is the frequency of which they're going to be tested? And so where does that testing get done? So there's so many questions as far as getting somebody ready on the preoperative, on that schedule. Any thoughts about how we're going to use a telemedicine environment to achieve that goal?
I just think that the things that we try to envision now that seem too space age are just around the corner, and somebody's seeing it as a problem that they can solve. So,
that's why we love our entrepreneurs.
Yes, exactly.
Yeah.
But But Joe, you probably have more specifics.
Well, I would say, despite the fact that and it was unfortunate on every level, Theranos set us way back, and Theranos became sort of people saying, "Well, that can't be done." As a matter of fact, I know of several companies that can take not the tiny amount of blood, but a couple of drops of blood and do all kinds of amazing things with it. And so that's, again, as Ann said, that is literally around the corner. It's in FDA clearance now and will be in the market in the next year or two. So lots and lots of things are moving into the home. There are devices that you can take your temperature, look in your throat, look in your ear. There's all kinds of things that will enhance our ability to make a telemedicine visit a very robust interaction with our patients and obviate the need to travel.
Right. There's a Israeli company that you can actually, in this sort of video interaction, they can evaluate your respiratory rate, your pulsicity. It's just phenomenal what can be done. And
is that Tidal Care that you're talking about?
No, this is Benai.
Okay.
But Tidal Care has the devices that, again, are being broadly distributed through organizations like Oxner Health, where you can look in the ear of a kid or the throat and determine with incredible accuracy whether or not they need to be seen or they should just jump to antibiotics.
Well, we need to wrap things up. So I think what I'd love to have you provide is, have you got some like 2 or 3 pieces of advice for the orthopedic community from the standpoint of thinking about, we've made some gains here. We are still learning. What would you it's interesting. I was going to say in the upcoming months, but things are moving so fast. It's like in the upcoming weeks. Yeah, really in the days and weeks. So as surgeries are opening, being scheduled, and we are in that recovery, and more states are removing their stay-at-home orders, and we are going to see more of this. What would be a couple of things that you would say, these are the core things that you need to pay attention to now in order to set this up and be successful and safe?
I'll start. I'll say workflow is paramount. In other words, just rethink and re-question every single thing that you have on your schedule. Does that person need to come in? And think hard about it, because the answer used to be yes, but it isn't always yes. And then that you can really start to then juggle your brick and mortar, think about how you use your non-clinical spaces, how you use your interactions with, or your telehealth interactions, and to create a really knit together experience. That's going to be the next challenge.
So every question should start with, how might we?
Yeah. That's probably true. Yeah.
Okay.
And I would just add to that to be incredibly proactive as you engage with your patients. I mean, virtual is not for everyone, just as it isn't for all physicians, it's not for all patients. And then the other advice I'd have is just to stay on top of the coding and the reimbursement, because I have heard so many stories of how challenging this is. Yeah. And, when you miscode, it can get construed as fraud, and that's not what anybody wants. And so it's really important to stay on top of that. We have some resources that we've posted on our website, americantelemed.org, and we just know that this is really, really important for the medical community.
Yeah, and that has been one of the major concerns. And so you guys are a great resource to help everybody with that. With that, I will just say thank you so much for joining us. And we've got all of your links that are available, so we encourage people to reach out to you. It's like you said, it is amazing, all of the partners who are coming together to really help us think about how we do this well, safely, and I would hope with joy and excitement, because it is really fun. And I think we forget that part. We're just talking about transaction, let's just get this done. But this is a lot of fun. So I appreciate your enthusiasm, and we'll look forward to checking in. Let's see, maybe we should check in next month, given the pace that we're moving at. Yeah,
it'll be a different interview for sure. Yeah, thank you.
Stay well, keep your hands washed, and
thank you.
Bye-bye.
Bye.